Can you go over the mechanism of action of bone marrow aspirate concentrate and PRP? What is happening when those therapies are put into the knee?
Yeah, so it's kind of like we're restarting the healing process. So as I said in the talk, the cells do the work. And so you can put the bone marrow cells into the knee and they can help repair damaged tissues. They can help grow some cartilage back. There have been some studies that show that some of the cartilage grows back. They can help repair the lining of the joint. They can help heal the bone if you put them into the bone, for sure. That's been shown as well. But they actually, interestingly, function also more like boss cells. So they will tell all the other cells in the area, or they'll recruit cells to come into the area to help heal as well. So they're kind of like Chip and Joanna Gaines. They come in, they can do the work themselves, but they also can, they basically tell other cells what to do. And so you're getting more of a repair and a remodeling. You're not necessarily getting a, quote, regeneration. I know people like to call it regenerative medicine, but it's more of a repair, remodeling. The PRP is more like fuel to the fire. So that's that's like fertilizer. So the PRP platelets have growth factors in them. And like I said, when you cut yourself, you form a scab, it stops the bleeding. So your platelets are what do that. And those platelets, once they form the scab, they release growth factors, and those growth factors stimulate new blood vessels and cells to come in the area. So there is some signals for stem cells to come into the area and kind of run the process, because the cells do the work. The fertilizer can't repair you. The fertilizer just stimulates the cells. And I'm being very, it's very much more complicated than this, by the way, but this is kind of a simple explanation. And so, yeah, the growth factors from the platelets are really more like fertilizer, and really more like a super concentrated fertilizer, like Miracle-Gro, and they add fuel to the fire, which helps these cells repair. But the cells are what do the work. Does that make sense?
Absolutely. And I will add to that, one of the more interesting things that, of course, I learned as we did more and more of these, right? Because I came on a little later in the process. Obviously, I wasn't there 33 years ago when you came up with the idea, right?
Were you born then? Were you born then?
I was born in 1995, so that's
okay. Good.
The fact that as you age, that signaling for stem cells and growth factor and all that lovely stuff to heal, as you age, that signal is maybe less effective, or it's harder to get to mobilize that stuff, which is why actually taking the bone marrow aspirate and putting it in there really accelerates that process, especially as you age. So, an older person can heal. Something that you always say is not like you're 18, but as if you were a younger person. It's giving you that kind of like a rejuvenation there.
Yeah, you're absolutely right. So as you get older, the platelets aren't quite as good as they used to be, as when like you're 16 or in your 20s, maybe even in your 30s. As you start getting past your 30s, the platelets don't work as well. They still work well, but you might need more than one injection. We like to get things all done in kind of one fell swoop. So there are people who do multiple injections, providers who will give you 3 injections, for instance, for just PRP. But we also feel that since the cells do the work, we almost always do cell-based therapy. We use the cells. But even then, you're right. Like in our arms and our legs, we have less and less cells in our bone marrow as we get older. So we don't have those cells to repair the area. The cells come out of our bone marrow and repair the area locally. So in our pelvis and in our spine, we still have really good stem cell supply right up into our 80s and 90s. So if we can take those good stem cells, concentrate them, and put them into the area where there's not as many stem cells anymore, it's just like reseeding the area. It's like reseeding the bad area with a good area. And it's amazing. It can help rotator cuffs heal better. It can help, any type of meniscus surgery, cartilage surgery heal better. It's really amazing how the body can help heal itself.